Hello, my name is Anne-Sophie Darlington, and I'm a professor of child and family psychological health at the University of Southampton. And I'm talking to you today about parents of a child with cancer and how they were coping or have been coping during the pandemic. And the study is called the SHARE study. Right, so how did it all begin? In 2020, in March 2020, I was looking on the website of the CCLG and seeing that they were updating their information around the virus all the time. And I reached out to Ashley Gamble of the CCLG and I asked whether it might be a good idea to ask parents how they were experiencing the virus outbreak. So we worked together with Dr. Bob Phillips and Dr. Jess Morgan to plan to ask parents how they were doing and what they needed. So what we did in the first instance, we actually asked parents whether it would be a good idea to ask them to complete a survey because, you know, these were tricky times and we didn't want to overburden them. But they said that it was important to try and find out the gaps and their fears and the support that they might need. So we were encouraged to do that. So what we did, we developed a survey together with parents and health professionals. We kept it quite short because that's what they told us to do. And then disseminated that survey through Southampton Hospital and Leeds Hospital, but also through Facebook and social media like Twitter. So we just tried to reach as many parents as we could to get them to fill in this survey. And what we focused on in the survey were their experiences. So very simply, how are you doing? And tell us more about what it's like, where they're getting their information from, the worries that they might have that really influence the decisions that they make, and also around support. What is it that they need? And what we did in the survey, we had some questions that they could agree or disagree with, but then we also had some open text boxes that they could just write in. That could just tell us as much as possible. And so we did this survey over several occasions. So we started in March, late March and April 2020, and 171 parents completed the survey. And then we did it again in June 2020 and then in February 21. And you can see that only 36 parents completed it, but it still gave us an indication of what was going on. So I'm going to talk to you now about some of those questions that we asked that people could agree or disagree with. And in the first section, it was about experiences. So we were really just asking how they were doing. And we asked them whether they were vigilant around the virus and cancer symptoms. And 92% said that actually they were. 85% said that they were worried about the virus. And 70% said that actually they felt that the hospital was not a safe place. So rather than just using this information to inform us at the time, we also thought we should do something about this. So for instance, in that case, Dr. Bob Phillips recorded a little TikTok video and he put it on Twitter as well to reassure parents about the hospital and that it's still a safe place. Then we also asked parents about information, as I said, and we asked them where they get their information from. And 84% said they got their information from social media. 49% from the clinical team, and then other parents were also a source of information. But as you can see from social media, we were also interested in finding out whether they trusted information. So we said, you look at information on social media, do you trust it? And actually very few parents trusted that information, which is interesting because it was similar to what we were all doing at the time, especially in the beginning of the pandemic, just finding a lot of information, wanting new information, but knowing that maybe the sources weren't so great. Now around decisions, and I guess a lot of the different worries that parents might be having were influencing their decision. So 89% said they were worried that the child would catch it from them as a parent. They also worried about their own health and they worried about nurses visiting the home. So actually that then influenced the way that they went about things. And it meant that actually they wouldn't go to the supermarket to get their food, so were dependent on other people. But they were very much trying to protect their child, as you would expect. And then in terms of support, we must admit that when we started the study, that actually we assumed, what we expected in a way, that actually maybe quite a few parents would like some support, maybe, so as it says here, financial or support for their worries, or support of how to deal with their child's worries. But as you can see from these percentages, that was about 20 to 30%, so not the majority of parents, which is interesting. What we did do is put in place a online intervention to help parents cope with having a child with cancer, but also in relation to COVID. So that might have then helped that group of parents that needed that support. We also, like I said, had a look at the open text boxes, so parents could write in there, and that's why you've got these quotes here of the kinds of things that they were saying. And the kinds of things that were coming out in terms of themes were very much related to the virus. Obviously, that risk of infection, parents saying here that the thought of that keeping them awake at night. And again, that information thing, constantly researching the internet, looking for case studies for reassurance. Parents also worried about the change in healthcare, about scans being cancelled, and that real sort of worry and fear of the unknown. But they also talked about things in relation to lockdown that was sort of a knock-on effect of the virus, and very much, many things they were talking about are very much related to psychological and social issues. The panic of not being able to be in control, worrying about their child's development, worrying about the child being isolated, things like that. But then on the other hand, they also felt quite safe because the whole of society was in lockdown. Those restrictions sort of made it easier, and it made them feel quite safe. But that changed over time as we were coming out of those lockdowns. One also difficult thing is that dependence on others. Having to rely on others for everything is not nice at all. And then obviously the worry about finances and parents making decisions to maybe not go to work to keep their family safe and to keep their child safe. But one of the things that came out throughout when all the things that the parents were writing was this need for information, this need for consistent and clear and up-to-date personalized information. That's what they said over and over again. So we also looked at what changed over time, because we obviously did the survey over several occasions, and we wanted to see if things were getting worse or getting better. You can see the blue bars here are the first survey that we did in sort of April 2020. And then the green bars are from June 20, and then the purplish ones are from February 21. And you can see that the worry about the virus, those first cluster of bars there, that went down a bit. So there was the worry about the virus quite high, obviously, as you would expect in April 2020, and that became a little bit less. Parents being sort of vigilant about symptoms became less as well, but actually was still quite high throughout. So parents are always looking for and worrying about symptoms that their child might have in relation to the virus and in relation to cancer. And then that third set there, treatment delay, we didn't really ask about that in the first survey, but we did in the second and third. And actually quite a few parents were worried about treatment being delayed or cancelled, and that having influence on their child's treatment. And then a fourth thing that I wanted to highlight was school support. As you can see that last set of bars. Initially, parents didn't need so much support around school, but actually after everyone had done the homeschooling and things like that, parents did say that they would like more support around school, because maybe their child was behind, or they were worried about their child going back to school in the autumn. And in terms of what they were writing, again, in June 2020, there was very much the information needs were very much related to the return to school. What will it mean for my child going back to school? What do I need to do? So they were more relaxed, but still quite cautious. And they were finding the restrictions around the hospitals quite difficult. The restrictions around visiting, the playroom being closed, things like that. And then worrying about new variants as they were kind of popping up, and we were getting all of that information. And then in February 2021, that worry about new variants was still there. And now the worry was also related to others adhering to guidance, because obviously people were needing to follow the rules, and it was distressing for parents to see that sometimes people didn't, and what that then would mean for them. But also they were talking about positive aspects. And this is really important to know, because we were obviously asking them a lot about worries and about things that might not be great. But also we said, well, what positive things might have come out? And they said, well, the time that you spend with your family, and the way that you organize your life. That's true for many of us. But again, even across those other two time points, always that need for the consistent, clear, up-to-date and personalized information. They were talking about that all the time. And so it's important that we take that message away from what we've learned from parents. So just to finish, why did we do all this? Well, we wanted to listen to parents' experience, and it's important for people to have a chance to tell us what that was, what they're experiencing, what it's like. But also it allows us to organize support where it's needed, but also to advocate and influence, because all this information is important to relate to others. And we also did this survey in other conditions, so we understood a lot across child health. So what we've learned that we need to listen to parents. They have a lot of things to tell us. They worried obviously quite a lot throughout about different things. What they really wanted was good information. And that relates then to this idea of uncertainty. There's been such a lot of uncertainty throughout the pandemic, obviously. And what you then need is trust, and you need the messages that you get to come from a trusted source, that you can be reassured that actually what you're getting is good information, and you can go with that information. So that's where I wanted to leave things. And I just want to thank all the people that have contributed to the study, especially the parents and the children, and the CCLG for supporting us to do this work. And hopefully we can get more information out to parents of what we've found very soon. Thank you very much.